Nemours Hospital for Children in Wilmington, Delaware. So we are living in unprecedented times. As we all know, the COVID-19 infections first started towards the end of 2019 and quickly spread throughout the world. The WHO declared it to be a pandemic on March 11th. And the initial data that came out of many places that first saw a surge in infection suggested that the disease was mild in children, very low numbers, and a lot of them were asymptomatic. And this was similar to the SARS epidemic that we had seen between 2002 and 2004. The numbers then overall were very small, but children were even smaller. Very few children were affected, and no deaths in children were reported then. And it was thought then and now that this was because children had immune systems that were different from adults and they responded differently to coronavirus infections. Then on April 12th, in the middle of this pandemic, we saw a 14-year-old boy here at Nemours Hospital for Children. He presented with fever, abdominal pain, vomiting, and diarrhea. And initially, we thought he might have appendicitis. But as we worked him up further, we saw that his heart function was severely decreased. And so we treated him as someone who has myocarditis or inflammation of the heart muscle. And fortunately, he responded very well to treatment and went home in a few days with no residual heart problems.
But we didn't know what had caused his condition at that time. His testing for COVID infection was negative at that time. Then on April 24th, new data emerged from Europe, which suggested the emergence of a syndrome which was thought to be inflammatory in nature, and children presented with fever and abdominal complaints after COVID infection. And many of them had involvement of the heart and specifically the heart muscle. And so when we saw that data, we sent antibody testing for COVID, which had newly become available at that time, on our patient, and it came back positive. So he was then diagnosed as one of the very early cases of what was then known as pediatric multisystem inflammatory syndrome in children associated with COVID-19, or PIMS, and subsequently labeled by the CDC as multisystem inflammatory syndrome in children associated with COVID-19, or MIS-C. And that's the name that has stuck, and that's how we call it today, MIS-C. So MIS-C as a syndrome is thought to be associated with COVID-19. Children present with fever and then one or more of findings of rash, conjunctivitis, maybe some redness of the mouth and tongue, swelling of the hand and feet, and then chest pain, shortness of breath, confusion or headache, and many of them have abdominal complaints. So abdominal pain, diarrhea, vomiting, and such. The good thing is, because of the technological advances today, we've been able to share data very quickly across the country, across the world, and find out what works and what doesn't. And so with the help of a highly qualified multi-specialty team here at Nemours, we were able to put together management protocols which work. And so all our children have done very well. We've had 17 kids so far diagnosed with MIS-C, and they've all gone home and all have recovered completely from what we can tell now. We do plan to follow them for a long time to make sure that we don't see any residual effects. But again, current data that we have is quite reassuring. And so then, what is this Kawasaki disease that we've been comparing MIS-C to? Kawasaki disease was a condition described by Dr. Tomisaku Kawasaki, who was a Japanese pediatrician, and he first described it in the 1970s. He recently passed away a couple of months ago at the age of 95, unrelated to any COVID causes. And so, since the time that he initially described it, I think we've learned how to identify and treat it, but we still don't know exactly what causes it. Like MIS-C, it is thought to be a post-infectious process mediated by the immune system of the body. And like MIS-C, it affects the heart. With a predominant involvement of the coronary arteries, or the blood vessels that supply the heart. What is different about MIS-C is that the children are usually older. So Kawasaki disease typically affects children less than 5 years of age. With MIS-C, we have seen the whole spectrum. So our youngest kid was 5 months old, and we've had 16 and 17-year-olds as well. It has been described in other centers in young adults as well. But again, the typical age is about 8 to 10 years of age. And then the ethnic distribution of MIS-C and Kawasaki disease are somewhat different as well. I think what is good about both of them is they respond well to treatment, specifically intravenous immune globulin, that is pooled plasma from donors. MIS-C presents a lot more with shock, and so they need blood pressure medicines to stabilize their blood pressure. And then we've used steroids more in children with MIS-C than Kawasaki disease. So again, we are living in unprecedented times. The American Heart Association has created a registry to collect data about the effects of COVID-19 on the heart in people of all ages. Nemours is very closely involved in ongoing research about MIS-C and COVID-19 and its effects on children and specifically the heart. So I think the lessons we learned today will define our new normals for tomorrow. And I think we owe it to our children to get it right. And so we at the Nemours Cardiac Center have had a very long association with the American Heart Association. They've been very crucial in providing grant funding for ongoing research and also in things that allow us to care for our children on a day-to-day basis. So Nemours partners with the American Heart Association in providing CPR training for the community. The American Heart Association has a very strong legislative arm, and this year I think they're focusing on anti-vaping legislation. They also have a very strong involvement with advocacy, and so they work with the Delaware Department of Transportation in trying to provide places where people can walk and be active, because that is so important for long-term heart health. And so their Heart Walk this year is virtual. I'm very excited about it. We have a wonderful t-shirt design from the Nemours Cardiac Center and a matching mask this year. So I'm looking forward to having that. And I hope to see you all at the Heart Walk.